Hello, it's Jess again. So let's talk about the patient with low back pain. Low back pain is very common, and some of us deal with it all the time. And so let's get into it. I'm going to share my screen so that you can, oops, there we go, see what it is that I'm talking about. And so low back pain affects about 80% of adults in the United States at least once. It's second only to headache as the most common pain complaint. And in people younger than age 45, low back pain is responsible for, that's the reason why people call out. And it's one of the nation's most costly healthcare problems too. So low back pain is common because the lumbar region bears most of the weight of the body. It's the most flexible region of the spinal column, and it contains nerve roots that are vulnerable to injury or disease. And it has an inherently poor biomechanical structure. So it has so many different vulnerabilities. That lower lumbar area, that area that starts below the rib cage and goes to the sacral area, and then that's where the hips join in. It's just so vulnerable to injury and disease because it's not built very well. So there are some different risk factors that are associated that can increase the incidence of low back pain, including lack of muscle tone, excessive body weight, poor posture. Cigarette smoking it definitely influences back pain a lot. Stress, and then common conditions that are easily associated with low back pain, prolonged periods of sitting. If you have repetitive heavy lifting, so people who are working in jobs that need to lift more than 50 pounds on a regular basis, nursing, and then people who are subject to vibration in their jobs, whether that's, let's say, people who are truck drivers, people who work in transportation because of the vibration of the work environment that they're in, because they're in something that's moving, and moving things have vibration. Transportation workers are often subject to low back pain as well. What other professions, other than the two that I mentioned, put people at a very high risk for back injuries and low back pain? What do you think? I'm gonna pause here for a few seconds, and then I'll keep moving. So more often than not, low back pain is often due to musculoskeletal problems. So you can have a muscle strain in that lumbar sacral muscle area. There can be instability in the actual bones of the lumbar spine. You can have arthritis of the lumbar sacral vertebrae. There is degenerative disc disease, and there's herniation of an intervertebral disc. I happen to be one of those lucky number 5s. So my S1, S2, I slipped and like totally biffed it on the ice, right? And like flat as a pancake onto my shoulders and my back. Oof, like had I hit my head, we would have been like probably taking me to the ED for some sutures. So what happened is my disc between S1 and S2 shifted out of where it's supposed to be. And so I've been doing lots of physical therapy. And then when I have flares, I restart that physical therapy as well. But yeah, no, I have, that's where herniation of the disc is where the disc, it's otherwise known as a slipped disc. That disc slips out of where it's supposed to be, and then it gets squished by the vertebrae. So some of the descriptors people will use or that you will find when you're evaluating people with low back pain is they'll have soreness or discomfort when a particular area is palpated. The pain occurs over a large area and it comes from deep within. That's using, if you're going to be using the word diffuse, this is a vocabulary slide. So localized is where if it's a specific area. Diffuse is if it is a large area and it comes from deep within. Radicular, vocabulary word, is caused by irritation of a nerve root. When I get low back pain, I get radicular pain because that vertebrae, that squished disc, is pushing on my sciatic nerve. And then it's referred. So you can feel it in the lower back, but the source is actually in a different location. So there's 4 different types of vocabulary words that are associated with low back pain. Here they are. So low back pain lasts 4 weeks or less if it's acute. So acute back pain is 4 weeks or less. If it's longer than that, it becomes chronic. The acute back pain is associated with some type of activity that causes undue stress on tissues of the lower back. Just as walking the dog and loses the balance on the ice and schmecks like a pancake onto the sidewalk. Someone else could be that they were lifting really heavy boxes and they turned wrong. It could be a variety of different things. Symptoms often don't appear at the time of injury, but they usually develop within about 24 hours because of gradual increases in the muscle spasms of the paravertebral area. So the muscle ache can be either shooting, it can be stabbing pain, it can be like a stiffness where there's limited flexibility and range of motion, or it can even be like an inability to stand upright. There are some things that we use for diagnosis. We'll use the straight leg raise and the straight cross leg raise. So use this particular link right here to see an example of the straight leg test. Use this link to see an example of the straight leg test. MRI and CT usually are not done unless they suspect some trauma or some sort of disease. It actually took me going through physical therapy for 2 months before I actually ended up getting any imaging done for my back pain, because it was treated as a muscular thing until physical therapy wasn't working. And then we moved into, well, if the physical therapy isn't working, then it must not be a muscle thing. Maybe it's a nerve or spine thing. So let's get some imaging done. Like, that's the progression of my low back pain. We can also do some x-rays. The x-rays aren't as great, but they're fast and they're inexpensive. Looking at that spinal disc space, we can also look for arthritic changes too. Acute low back pain is usually treated on an outpatient basis if acute muscle spasms of pain aren't severe and debilitating. So we'll start with analgesics like NSAIDs, Tylenol, ibuprofen, maybe a little Toradol. You can, it wouldn't be uncommon, especially if it's muscular in nature, to have a person who is given a prescription for cyclobenzaprine, otherwise known as Flexeril. That does have some, muscle relaxers do have some addictive properties. They're not full on class A medications, but there's lots of restrictions surrounding muscle relaxers being prescribed. It's not uncommon for a person to get relief from massage or from chiropractic back manipulation, alternating hot and cold compresses. If it's really severe pain, some opioids might be in appropriate intervention, and appropriate, not inappropriate, and appropriate intervention. Manipulation of the spine, like I said, with chiropractic Acupuncture can be helpful as well. I ended up getting a steroid shot, and that is so that I got a steroid shot so that my physical therapy could be even better. So then I could strengthen the muscles and support that lower back even better. I also ended up doing a form of acupuncture with, it was like an acupuncture and a TENS unit combined. It's called dry needling. I'm sure my back looked really funky. I could not see it. But it was a combination of acupuncture and a TENS unit that I used to help eventually. That was what actually really got my back sorted out. So. As far as nursing interventions, the primary nursing responsibilities include assisting patients to maintain activity limitations. You know, pay attention to your lift restrictions, pay attention to your work restrictions, etc. We're in charge of promoting comfort, educating the patient about the problem, educating them about appropriate exercises, and then how to use their analgesics, their NSAIDs, their muscle relaxants, and their thermotherapy while avoiding bed rest. Bed rest is not their ideal right now. You may need to get a little Ultram. You may need to advocate for some Ultram or some opioids to be able to help these people. Nursing diagnoses commonly associated with low back pain include acute pain, impaired physical mobility, ineffective coping, and ineffective self-health management. And so when we're doing a plan and we're putting together goals, appropriate goals are satisfactory pain relief, avoiding constipation secondary to medication, and immobility. We need to move. Moving helps us poop. If we're not moving and if we put some opioids on top of that, then we're really not pooping, and then we end up with a bowel obstruction or constipation or both. Learning back sparing practices such as lifting with your legs and not with your back, and other things. And then returning to the previous level of activity within prescribed prescriptions. Just so that you're aware, there is a difference. Remember, I said there's a difference between acute pain and acute back pain and chronic back pain. So chronic back pain will be lasting longer than 3 months or have repeat episodes, and it's usually progressive. So it's getting worse, just gets worse over a long period of time. Causes for chronic low back pain include degenerative conditions like arthritis, or disc disease. Osteoporosis or other metabolic bone diseases can create pain as well, as that bone is becoming more porous and the bone disease is impeding the structural stability of the bones in the back. You may have weakness from scar tissue of previous injuries. People with chronic back pain may have chronic back or chronic strain on their lower back muscles, perhaps from obesity or pregnancy or stressful postures on the job. I just always think of, when I think about stressful postures that I've seen in the hospital, I think of the people who have to lean over the bed. Like, let's say for whatever reason, you have a surgeon who needs to lean over the table to be able to work on the patient for a long amount of time. That creates a lot of stress on the body. Some people may have birth defects, otherwise known as congenital spine problems, that create issues. And then there is something called spinal stenosis, where that spinal canal that runs all the way up and down the spine. The stenosis means that it's getting narrowed. So osteoarthritis will end up compressing on that spinal cord, and that compression causes inflammation. And inflammation results in pain and weakness and numbness, because the nerves can't do what they need to do. So that inflammation creates several different problems. So that's all that I have. Quick down and dirty 15 minutes about back pain. And I'm going to keep on making recordings, and I will see you. Please reach out if you have any questions. And I will see you in the next recording or in class.